Glad to have you back. If you're just joining us this morning, you're watching The Conversation right here on Lagos Television. Now, every second week of March is dedicated as the World Glaucoma Week, and it is also a week to highlight the need for regular eye check and to sensitize the public on early diagnosis of the largely asymptomatic and devastating disease called glaucoma. Now, I'm not a doctor, but from what I've read, glaucoma is a condition in which the optic nerve is progressively and irreversibly damaged, resulting in loss of vision and all that. Now, I'm not a doctor, but I think it's a conversation that must be had considering the number of people that are affected by this very dangerous challenge called glaucoma. Now, our conversation this morning is about glaucoma awareness, detection, and treatment. We've got a medical doctor here in the studio, or Dr. Chinedu Anthony Okeke is a consultant, ophthalmologist, and glaucoma specialist. It's a pleasure to have you join us in the studio.
Thank you very much.
Yes, I'm sure you're wondering where I got my definition from. I read up on that. Okay, but first off, why do we need to have a glaucoma awareness week? I think let us start from there before we begin to go to what glaucoma is and why we need to talk about it.
Yes, thank you once again. So because of the burden of glaucoma, because of the way glaucoma presents, and because of the damage that occurs from untreated glaucoma, the International Association of International Agency for Prevention of Blindness, the WHO, and the Ophthalmological Society of Nigeria all came up with this idea that it is better to let people know about their condition early in the course of the disease to prevent blindness. One very bad aspect of glaucoma is that in the initial stages, the visual loss, the patient doesn't know that he's having any problems. And by the time you notice that you have a problem with your eyes, up to 70 to 80% of the eyes are damaged. And because of that, the doctors, including the ophthalmologists and the optometrists and all those that are involved in eye care, feel that it is very important that people should get their eyes checked so that if we can detect the disease early on, when it's just starting, we can stop the disease or slow down the progression of the disease.
Okay. In this part of the world, I doubt if people are very conscious or interested in getting their eyes checked. And what really is glaucoma, and is it just one type that we have, or there are several types of glaucoma? And then the symptoms that will tell me that something is wrong with my eyes. What are those symptoms that I'm likely to see to tell me that something is wrong with my eyes?
Yeah, thank you. Now, by definition, glaucoma is a group of diseases. Initially, we used to think that glaucoma was just one disease, but we now found out that it was a group of diseases that have something in common, which is that they cause progressive loss of vision. And when you look at the eyes, you have this characteristic cupping of the optic nerve. The optic nerve is the nerve that connects the eye to the brain. It's also called the nerve of vision. So we have this group of diseases that causes progressive, slow loss of vision. Unfortunately, the visual loss is irreversible. Now, in many cases, glaucoma also comes with an elevated intraocular pressure. What we mean by that is that high pressure in the eyes. Now, the commonest form of glaucoma is called the open angle glaucoma. Unfortunately, early on in the disease, we have very little or no symptoms. That makes glaucoma dangerous. As a matter of fact, another name will come.
So even if I have it, I might not know?
Yes. The type of glaucoma called the open angle glaucoma. Okay. You may not even know. And that's why we also call it the silent thief of sight. You know, naturally, if your eyes are itching you or your eyes are paining you, you go to the hospital to check it out. But people that have glaucoma keep seeing well until late into the disease. And because it's very common in blacks and in Nigerians, we advocate that everyone, especially if you're up to 40 years and above, or if someone in your family had glaucoma, or someone was blind in your family, and also if you have some medical conditions like hypertension or diabetes, you should, as a duty, make sure that you go for an eye check at least once every year. That is the only way we can detect if you have glaucoma or not. And while detecting it early, we can now stop the disease or slow down the progression of the disease.
Okay, that brings me to, I think you've mentioned it. According to a report, like 50 years and above seen over the 5-year period have tendency to have it, but you just mentioned 40. What's the prevalence like? I have different numbers here on my phone, and it's not pretty conclusive. But how prevalent is it? One in how many are likely to have glaucoma?
Yes. Now, the prevalence rate of glaucoma varies in different populations. Even in Nigeria, the prevalence rate varies also in regions. But there was a study, we call it the Nigerian National Blindness and Visual Impairment Survey Study, and it showed that 1 in every 20 Nigerians have glaucoma. Unfortunately, 9 out of 10 of those people don't even know that they have glaucoma. So it's only about 1% of the people that have glaucoma know they have glaucoma. So if you have 20 people, 20 Africans from 40 years and above, you find out that 1 out of 20 of them have glaucoma. Now, another bad statistics that we need to know is that 1.2 million people that have glaucoma will eventually get blind from glaucoma. As a matter of fact,
If untreated.
If untreated. As a matter of fact, to bring it down home, you find out that 5 out of 10 people that have glaucoma, which was untreated, will lose vision in at least one eye. So it's very common. And then when you come to Nigeria, we mentioned the age, we find out that as one is getting older, the prevalence of glaucoma increases. Some people, maybe when they were 30 years, there was nothing wrong with them. They find out that by the time they are 60 or 70, they already have glaucoma. Also, results from the survey showed that people from some ethnic background have more glaucoma than the normal population. It has been shown that people in the Southeast have a higher prevalence of glaucoma than other tribes. Now, why we are mentioning all these things are trying to break out the risk factors, what people should look out for.
Yes.
Encouraging them to go and have their eye check. Unfortunately, just like we said earlier, in many cases of glaucoma, it doesn't present with symptoms early. And it's only when you go to the hospital, when you go to the eye doctor, and he examines your eye that he'll be able to say whether you have glaucoma or not.
So what are the symptoms?
So some people, the major symptom of glaucoma, especially when it has already gotten advanced, is that person notices that he doesn't see things clearly, especially things that come from the sides. So we call it peripheral loss of vision. You are seeing things that are in front of you, but things on the side, on the other side, you don't see them clearly, which is dangerous, especially for people that are driving, or people you find out that keep bumping into objects, or they miss their steps. Another common symptom, especially for spectacle wearers, is that you find out that you keep changing your glasses. You wear glasses, after 2 months, 3 months, 6 months, you say you're no longer seeing with it. So the major symptom of glaucoma is loss of vision, blurry vision. Some people also complain about cloudiness of vision. You find out, you wake up in the morning, you feel as if there is harmattan everywhere, the vision, as if it wants to rain. Those are signs of glaucoma. Now, there's a type of glaucoma we call the angle closure glaucoma. That one is a medical emergency because it comes with pain, very severe pain. and rapid loss of vision. It's also a type of glaucoma, and when you examine the patient, you find out that the pressure in the eye is quite high, and with appropriate intervention, the patient's vision can come back.
Okay. How do I know if my eyes are under pressure? And then earlier you mentioned primary open angle glaucoma and then primary angle closure glaucoma. So what are the other types that we have? Then how do I know that my eyes are under pressure?
Yes. Now, when we classify glaucoma, we can classify them as primary and secondary. When we say secondary, it means that a disease condition or trauma is the cause of the glaucoma. Primary is that the person probably inherited the disease. He didn't do anything wrong. It's just that you're a black man or you have a family history of glaucoma. In primary glaucoma, we have two types, depending on the pathology or the mechanism of action of the disease. We call the open angle glaucoma and the angle closure glaucoma. These are medical terms that describe how the aqueous humor in the eye flows. When the trabecular meshwork is obstructed, we call it an open angle glaucoma. The pathology there is that the angle is open, but there is obstruction of the trabecular meshwork, or the trabecular meshwork is not functioning properly. The second type is the angle closure, whereby we don't have a direct view of the angle, which has been closed by the iris. So these are the major classes of glaucoma. Now, ordinarily, you may not know that the pressure in your eye is high. Just like you have a high blood pressure, you can also have a high eye pressure. But when you go to the clinic and the doctor uses a machine called the tonometer, he uses that machine to examine and measure the pressure in your eye, what we call the intraocular pressure. Having said that, there are some types of glaucoma that happens even though the pressure in the eye is not very high. We call them normal tension glaucoma. So we don't use only pressure to diagnose glaucoma, but we use examination, clinical examination and investigations to make a diagnosis of glaucoma.
My colleague's got a question for you.
Yes, I want to find out if after going for your regular checkups, with of the eyes for glaucoma, that you can still eventually go blind.
Yeah, thank you, Ma. Now, the good thing about glaucoma is that if detected early, we stop the progression of the disease and prevent blindness. That's the major reason why we go to check our eyes, to prevent blindness.
Blindness, okay.
In very rare cases of glaucoma, you have what we call fulminant or very malignant glaucoma, whereby the doctors try as much as possible to reduce the pressure in the eye, and then it doesn't work. In such rare cases, the patient can still go blind or lose vision. But in the majority of cases, once you go to the hospital and you start treatment, you will not, most likely not go blind from the disease.
Okay, talking about treatment now, what are the types of treatment available and how affordable are they? That's one. On the second hand, I also read somewhere that there is a particular one called developmental congenital glaucoma, and that is common in babies and children.
Yes, thank you. So we mentioned that glaucoma is more common in adults, but we also have glaucoma in children. And the glaucoma in children, we call it congenital glaucoma. Sometimes it's also hereditary. It runs in families. So the pathology there is that there is an abnormality in the drainage pathway in the child's eye. Now, when the child is born, the eyes are swollen, the cornea is white, and then the child is always tearing and always crying. So we quickly, when we do surgery for the child, we restore the normal flow of aqueous, and you find out there's a reversal of such things. However, especially in families that have glaucoma, you find out that their children tend to have the glaucoma earlier. So you don't even get to 40 years. You see that a child of 13 years, 12 years already has glaucoma. So the government encourages, especially school-age children, to have an eye check, especially when they're entering school. Those are the opportunities where we can detect whether the child has glaucoma or any other eye disease. Now, talking about treatment or management of glaucoma, we can classify it into two types. The first one is the medical treatment. And the major aim of treatment is to reduce the pressure in the eye. So we can use medical treatment like drugs, eye drops, or tablets. The work of those drugs is to reduce the pressure in the eye. We can use lasers. For example, what we call the selective laser trabeculoplasty, argon laser trabeculoplasty. The aim of all these things is to reduce the pressure in the eye. Finally, we can also use surgery. What surgery does is to create another avenue for the excess pressure in the eye to enter into the bloodstream. That is the first part of the treatment. The second part of the treatment is what we call lifestyle modification. We find that there are some things in your lifestyle that makes the glaucoma to get worse. For example, people that smoke. When you smoke, it makes your glaucoma to get worse. And then we've also seen some foods like caffeine, coffee. Coffee has a way of increasing the pressure in the eye. So people that have glaucoma should try to limit the amount of coffee that they take. There are some drugs, especially the steroids, that we know that increases the pressure in the eye and causes glaucoma. Now, people that have hypertension and is poorly controlled, people that have diabetes, that worsens the glaucoma. Now, what are the things one can do to help, especially lifestyle modifications? The first one is exercise, moderate exercise, especially aerobic exercises. We have seen that it helps to increase the circulation of blood to the eye and reduces the pressure in the eye. Also, some foods that one takes. We encourage people to take a balanced diet, but more especially foods that are rich in antioxidants and also omega-3 fatty acids. These substances and some minerals have been shown to increase blood circulation to the optic nerve, reduce the pressure, and also protect the retina. We find out that things like carrots, cucumber, green leafy vegetables, things that contain things like lutein and zeaxanthin, egg yolk, omega-3 fatty acids containing foods like salmon, tuna, sardine. All these foods are good for the eyes.
Egg yolk? Kids
Yes.
don't like to take it.
Yes, we have to encourage them because we have been seeing that it helps with the retina, it helps to protect the retina, it helps to improve the functionality of the retina, and the pathology of glaucoma starts by loss of the retinal ganglion cells. So if we can encourage or improve the health of the retina, it also helps to reduce glaucoma.
Now, the theme for this year is Uniting for a Glaucoma-Free World, See the Future Clearly. The organization, what is the world trying to achieve with glaucoma? Because glaucoma is the least of the problems so many people have. You say they should go for checks, regular check, at least once in a year. Apart from all the politicians or good-spirited people that say, come to this particular point for eye check, paying out of pocket has been a major challenge. I know how much I actually pay for my glasses. And my daddy uses, my mommy uses, my brother uses, his kids uses. In my family, in fact, if you don't go for check, you know that there's a problem somewhere. You just have to go. But I know it is off the shelf. There's no health insurance to take up. They're pretty expensive. And in fact, mine is like every 2 years, the doctor says your eyes you need to move it again, and the lenses aren't cheap. People want to eat food. You are telling them to go and watch their eyes. How do you marry it? How do you want them to see the future clearly when their tummy is in danger?
Yes, that's a very good point you raised. The association, the Ophthalmological Society of Nigeria, once or twice a year, especially this month of March, we organize free eye checkups. You find that major centers, general hospitals, private hospitals, even churches, mosques, we organize awareness programs. We encourage people to come to check their eyes for free. That doesn't mean that you should be waiting for the free eye checkup before you can go and check your eyes. You should routinely go to check your eyes. We find out that a lot of us go to the hospital and say we want to do a comprehensive test. But we don't remember the eye. You check your prostate, you check your cholesterol, check your blood pressure, you check your sugar. For women, they check their breasts and their cervix. But no one remembers the eye. And we know that one of the most important organs in the body is the eye. Now, why are we talking about seeing clearly for the future? We know the burden that blindness does to the society. Let's take, for example, a woman is blind. The child probably won't be going to school because the child has to be carried the woman around. So you can imagine the blindness is not only affecting the woman, it's also affecting the child. One, the person is no longer able to contribute economically to the family. So there's loss of income to the family and becomes more of a burden to the society. So the best way to alleviate all these things is to prevent blindness. We can never underestimate the importance of prevention of blindness in the society.
So if detected early, there is every possibility that one might not go blind.
Yes, sir.
Then how do you determine the type of eye drop that you are meant to use?
Yes. So because we have different types of glaucoma, there's what we call the target intraocular pressure. Now, we have different types of drugs that reduces the pressure. So the doctor calculates the amount of reduction he needs and then tells it to the type of drug that you will use to reduce the pressure. Also, because people are different, some of the drugs have some side effects that may not be suitable to Mr. A. So you can now decide to use the drug type B for Mr. A because of the side effects. Also, the doctor considers what we call systemic diseases. For example, there are some eye drops or drugs for glaucoma that we cannot use in people that have asthma, in people that have hypertension, or people that have diabetes, or people that have inflammation in the eye. So the choice of drugs for treatment of glaucoma.
So people also have inflammation in the eye?
Yes. You can have inflammation in the eye, what we call uveitis, inflammation of the structures of the eye. So the choice of drug for treatment of glaucoma is usually reserved to the doctor, who considers several other factors before getting to that decision.
Okay.
Yes. Is there a link between cataract and glaucoma?
Yes, ma'am. So a lot of people know about cataract already, and that is the commonest cause of blindness worldwide. Fortunately, the blindness caused by cataract is reversible. Once you remove the cataract through surgery or through any procedure, the patient starts to see. Unlike in glaucoma, where the blindness is irreversible. Once someone goes blind from glaucoma, the person is irreversibly blind. Now, both cataract and glaucoma occurs as people are getting older. So what they have in common is that they affect older people more than the younger people. However, sometimes when one has cataracts and it is not attended to early enough, what happens is that the lens in the eye, which is now cataractus, swells up and obstructs the flow of aqueous in the eye, leading to angle closure glaucoma. What am I trying to say? I'm saying that in some cases, cataract can even cause glaucoma. Because you see some people that have cataract, they tell them, let's remove the cataract so that you can see clearly. Say, no, I'm afraid of surgery. And eventually the person goes blind because he has left the cataract for too long, and then other problems, including glaucoma, have now joined the cataract.
Okay, as we wrap up this segment, what exactly will you be saying to the millions of people watching us now as to the best way to go about taking care of their eye and to avoid this intractable disease called glaucoma? Yes.
What we are saying, and which is what we have always said, is that people should take care of their eyes. Regard your eye health as a priority. Do not neglect your eye health. If you have complaints with your eye, go and attend to it early. Secondly, make it a routine, whether you have any eye problems or you don't, whether your eye is itchy you or not. Make sure that at least once a year you go to your ophthalmologist or your optometrist to get your eyes checked. That way, we can detect any problem with your eyes early enough and prevent blindness.
I want to say thank you very much, our consultant, ophthalmologist, and glaucoma specialist, Dr. Chinedu Anthony Okeke. It's a pleasure to have you join us this morning.
Thank you, sir.
To talk about how to treat our eyes, prevent it, and what exactly is glaucoma and what it does to people. Well, I think regular check answers it all. Do that as much as you can. We'll take a very short break. The show continues after the break. Don't go anywhere.